I would like to talk a little bit more in detail about how we do the surgery. You come to the hospital, you go back to the operating room, and the anesthesiologist will help you go off to sleep. We then position you on the operating table on your stomach with your back up. Make sure that all of the areas where there's any possible pressure are padded. The back is cleansed and draped. We then need to get exposure to the back so we can see what we're doing. And an incision is made and the muscle is dissected so that we can see what we're doing on the spine. Most of the postoperative pain is actually from this exposure step. The next thing I do is I remove part of the spine, and I do so that I can get a good look at the nerves. There's also joints in the back that may be removed, as well as thickened ligament, disc material, and bone spurs, and sometimes even cysts or other material that are pressing on the nerves. Once those are all removed, I get an intraoperative CT scan, and I use the scan to put screws in the back. The scan helps to make sure that the screws are very accurately placed. Finally, we take the bone material that we've harvested from the spine and we grind it up and put it back in. Sometimes we take the disc completely out and pack the disc space with bone. Other times we just put the bone out to the side away from the nerves, where the bone can form a bony fusion between the segments that we want to fuse. Once all of that is done, we get another CT scan, and this is done so that we can look at everything. We know exactly where the screws are. We know exactly what this spinal alignment is like, and we can also see if the neuroforamen and central canal of the spine are open. If we're happy with the way things look, the wound will be carefully inspected and then closed in layers with skin glue for the skin. Thank you.